We don't, as a society, recognise how common mental health problems are. 1 in 4 of the UK population will experience a mental health problem during their lifetime. And if we think about a condition like dementia, there are just under 1 million people with the condition in the UK today, but that number is going to double every 20 years. So we have quite prevalent, quite common conditions, and not many things we can do to alleviate the symptoms, the suffering, the difficulties that people have. I'm Martin Knapp. I work here at the LSE, and I direct a research centre that focuses on healthcare, particularly mental health and social care research. For example, some of the work we're doing for LSE Consulting is focusing on some of the midlife risk factors for developing dementia later on. So what we're interested in is whether we can find ways to encourage people to participate in better health behaviours and what the economic arguments might be for doing so. Dementia is itself very distressing, but it's also very costly for the healthcare system, for families. So we compare the costs of the intervention in midlife with the costs of dementia in late life. The other example would be some work we did through LSE Consulting 5 years ago, which is still having quite a lot of influence, was look at 15 different interventions in the mental health area and ask for each of them, is there an economic case for them? They included anti-bullying, workplace initiatives, work with young mothers, with children with behavioural issues. And in each case, we were able to show that investing in an intervention, whether it was prevention or treatment, would lead to economic benefits. And so many local parts of the health service have taken this up. We've had influences on GP training, on school programs, on what employers do to uncover risks of mental health problems. So I think we've been quite successful in using the research to change things in the real world.